Yes,
Perfect.
we're good.
Okay, so we have a couple more people online today. We have Paula, and we have Tom, and we have Daniel, who's in from Idaho, joining us for the first time on one of our seminars. And we're going to talk about health and medical device literacy, specifically about blood pressure. Maybe it's not sliding. Next slide. Why is that? There we go. So there is an importance and challenges of cardiovascular diseases and measuring blood pressure. Some of these challenges you're familiar with from your previous reading. We will also have a couple of activities. We're going to ask you if you would be kind enough to create a 30-second healthy blood pressure video in English, as well as if you speak another language or if you know someone who speaks another language. If you want to do this in pairs or teams or by the group, that would be really great. But we'd love to hear your voice telling people about the importance of monitoring blood pressure and what kinds of clues and cues you can help people to understand. We want to ask you to help make a healthy, quick food guide, something that's the foods that you like that are healthy. Same thing about activities. And then we want to lead you into an experiment where you take blood pressure yourself. And we've sent you some devices that you'll be able to use in the future if you don't already have some devices available to you. We want to remind you that we're using our measurements as a way to observe the system of health, which is homeostasis. It doesn't mean that blood pressure is by itself the only indicator of health, but it's a way of getting some insight into your health and well-being. One of the important things that we want to remind you about is that the social determinants of health are all around us, things like globalization, urbanization, aging, income, education, and housing, which affect your health. Over time, behavior and other factors affect your health, such as eating, using tobacco, having or not having physical activity in your life, the harmful use of alcohol, and some other habits that people might develop. And also your metabolic risk factors affect your health, things like high blood pressure, obesity, having high blood sugar or high blood cholesterol. And also, I'm having trouble seeing the slides myself because everybody's picture is up there, and so I can't see my slides. So these things eventually can lead to bad outcomes from cardiovascular health, such as heart attack, stroke, dementia, heart failure, and kidney disease, or other kinds of organ failure. So we just want to point out to you that there's a need for inclusion and diversity in all aspects of healthcare and in research and in engineering, because each special population has special needs. When infants are young, their body surface area is different, so their vascular system is more fragile. Their heart may have different properties than people who are older. And as you develop through adolescence and into adulthood, then various measures change. You're no longer in a population of people who are evaluated based on a population like the 90th and 95th percentile range. You're then evaluated by outcome measures, things like heart attack and stroke and so forth become the outcome measures. And you'll notice that in the literature that you've been reading, you'll notice that the way that the scientists approach their experiments is different because the age group or other attributes of the population have changed. Those things are very important for science, for engineering, for health, and in your life. So why is blood pressure important? Because if you can detect that you're having some issue with blood pressure, there's in many cases, there's something you can do about it. You can change your diet, improve exercise, or you can get some help from physicians to figure out what the cause is of the change in blood pressure. And if we are not able to understand these things, then we can actually have problems that it puts people at risk to not understand these things. It puts patients, individuals, and society at risk. So we want to point out to you that health and well-being is a lifelong pursuit. It's not just today for this lesson, but it's also things that will evolve over time. The research evolves over time, the information, the devices evolve over time, your personal and family needs change, and access to information is not always very easy. Sometimes you have to find a specialist who can help you access this. But if you learn about how to access information, which you're doing today, this might be very helpful to you in your life. Learning how to act upon that information is also something that changes over your life. Many errors can arise in the process of health and well-being, which you've already learned about, what kinds of errors can happen in measuring blood pressure, for example. And of course, we have this issue of cultural and linguistic variability. We have a diversity index in this country alone of about 61%, which means that there are people who speak many languages, that come from different cultures, and who may suffer from different kinds of injuries that affect their ability to understand, like dementia or issues with communicating. So these things are important for us to all keep in mind in our communities, among our friends and our family, and so forth. This is a call for innovation. Paula, do you want to spend a couple moments talking about this slide?
Yes, thank you, Kit. Very important that we look at the opportunity. We have issues related with regulation. As Kit was mentioning, we're constantly having new discoveries, new measurements, new procedures, new treatments, and all of that needs to be properly validated. So the opportunity to of regulation and validation, that we are 100% certain that what is the devices that we're using are properly described and are properly used. Is the need of new accreditation of laboratories, especially for the performance of blood pressure device, an online validation that the consumers are able to reach out and find information that allows them to be certain that these devices that are available in the market are properly evaluated. And then the establishment of an independent scientific forum where we can list these accurate measurements. And also, like he was mentioned, it's important that we have records that are proper for the variability of the population. As Kid was mentioning, as the persons evolve, the measurements for the child are different from the measurements from an adult, and then are yet different for an elderly person. So we have to accommodate for their variabilities and also understand the different medical conditions that will affect the variability, but they are within the proper conditions. So then when a measurement triggers an alert, we have to understand the context within that these measurements are being done. Anything else you would like me to add, Kit?
Nope, that's perfect. Thank you.
you.
So if you're in your little situation taking blood pressure, as you see in the upper left-hand corner, this is the device that you'll be receiving in the mail from us. So you'll be able to take measures with this device. We're going to show you can see that illustration. It looks the most correct of any illustration I could find about what position you're supposed to be in. Perhaps we can make a better connection between the person, the device, the medical help, and important information so you can understand the context, you can understand the reading, and so forth. And that's what the project is that we're all trying to move forward in our IEEE group. This is a much larger, more in-depth perspective of that project. On the top, you'll see people with different characteristics. You see the woman who's pregnant, you see the child, you see the doctor. The next row, you see the blood pressure cuff. Next to it, you see a shocking reading from the blood pressure cuff, something that would make your hair stand on end, where your blood pressure reads 192 over 132. Well, many things could be going on here. It turns out that this device shouldn't be used close to other certain kinds of devices, like an implanted pacemaker, for example. But you might not know that if you didn't read all the way through the user guide. So our project is to help people and companies understand how important it is to connect the user directly to the piece of information that's most important to them in that context. And so some of the things already exist, but they're not all connected. And our project is about connecting those things. In the next row, you'll see on the left-hand side, the validation application. It's called validatebp.org. And what we did when we selected this blood pressure cuff is that we looked online to see which blood pressure cuffs were validated that had some of the characteristics we were looking for that we wanted to share with you. And we found that this particular silver Omron blood pressure cuff is indeed validated. We also noticed that it's listed in this generic open access database called GUDID. So we can learn a lot about the product and the manufacturer and lots of things about that manufacturer in the open access database. And then beneath that, we have a row of further information that's available. Each of those pieces of information is independently available, and we'd like to figure out a way to make a useful connection among these pieces of information. So these are things we could ask you to provide us with input about. And if you'd like to become involved with programming some of these apps, please reach out to us and your teacher and let us know if you have time and interest. So of course, getting back to blood pressure, we don't want to dwell too much on this because I know you can read this on your own, but it is a leading cause of death globally. That doesn't mean that you're going to die of blood pressure trouble. It could be some other health problem. And the proxy of blood pressure is the thing that indicates your body is having a problem. The important thing is to notice that blood pressure and then try to track down the thing that's in need of being helped. One of the things that we know is important is diet and exercise, and we'll talk about that during this discussion. We also noticed that heart disease is, although it's the highest killer, it's also very closely related with other diseases. Stroke, Alzheimer's, diabetes, and kidney disease are all very closely linked with heart disease. But you can see that heart disease winds up rising to the highest level of death. And we are hoping that we can make a change in that in your lifetime. About 1 in 5 people who are women have hypertension, about 1 in 4 men. And this is the clue that people want us to know about to help simplify and reduce our risk of cardiovascular disease. Of course, learning about cholesterol, about blood sugar, about diet, weight, exercise, stopping smoking, and taking blood pressure measurements. This is an eye chart of a slide, but what's important to notice here is that long yellow line, the fourth one down on the left, that's the pediatric or the child, the young person food profile, what people are eating when they're young. And there's not much blue available there. Blue is the ideal food profile. And it continues into adulthood. On the right-hand side, the same row, you can see that there's not much blue on that row, meaning that people are not really eating a very healthy diet. And that's something we can really do something about. And it's interesting that it begins so early in life, that there's an issue with diet. These are some of the effects you can see we talked about in our previous session about how cold can affect your health, and that it can affect your health not just on one day, but that's because it triggers a cascade of effects. And this lovely slide will help you to begin understanding how that cascade of effects takes place over time when you are exposed to cold. And the same thing for heat, although this happens in a shorter period of time. There are many intervening factors that lead to stroke, multiple organ failure, or cardiovascular system dysfunction. And these are very good ideas. It's a very nice chart to help you navigate through further research in this area if you're interested. Salt is another area that people are most concerned about, because people tell you that salt is a very risky thing to have in your diet. It can lead to poor health, high blood pressure, and other problems.
You have a question real quick. Sorry. Sure. Can you go back a slide?
Sure.
They wanted to know one more, actually, why cold was such a factor again. They wanted to be reminded about why cold was such a factor.
Excellent. So over time, we develop either an increase in the activation of this sensory neural system. We have to look up these acronyms because I'm at the moment my brain is going off on them. But in terms of the arteries and the hemodynamics, when we're in the cold, we tend to urinate, we become dehydrated, we lose the viscosity, we get hyperviscosity of our blood, for example. So our blood becomes very thick, in the cold. And when that happens, it's not flowing. There's this laminar flow that we're supposed to have in our blood veins. And when that doesn't happen, we develop small blood clots, very small blood clots that can go into the microvascular part of our body. And that creates a process that takes some time that can ultimately lead to what they show you on the right-hand side, which is an ischemic stroke or thromboembolism, or even a hemorrhagic stroke. And in the next one about the arteries, we can actually have atherosclerosis, a buildup of plaque in the veins themselves because of these cascade of effects from being in the cold. In addition, our core body temperature, when our core body temperature changes, it sets off another kind of cascade of effects, which you'll notice happens more quickly in the heat than in the cold. But then there's also mitochondrial injury, as you notice, from the heart point of view, which can lead directly to a myocardial infarction or other cardiac dysfunction. And so this is a very complex area. When we gave you a list of reading materials, we tried to give you some details in some areas and also some broad things. There's a compendium there on cardiovascular health. It's a very big compendium. It's one of the 3 top references that we sent to you. And that is like an encyclopedia on cardiac health. And you should be able to find each one of these topics in that compendium. But the short answer to the question is there's a series of events that happen in your body that are triggered by the cold. And that ultimately leads to a poor outcome. And not necessarily today, but over the course of your life, it can build up. Does that make sense?
Yes, thank you. Yes.
Just to notice, this is a prolonged period of time. It's not just one morning that you are exposed 5 minutes to the cold, right? And the same thing with the heat. Yeah,
so if you're outside shoveling snow, that could be long enough to be exposed to the cold, depending on how old you are and what your physical condition is. And the same thing with the heat. But the heat could affect someone at any age. Salt is something also, we need enough salt, but not too much salt in our blood, because our blood has to have some properties in order to make sure that our metabolism functions, that our cells actually function. We need sodium in our blood, but not too much sodium. And this is an example of how the salt resistance is actually in the 72 percentile of some studies that have been conducted. Not everybody has been studied in this area. Again, you have sampling problems, biases in terms of who's been studied, who hasn't been studied. And of course, the salt sensitivity, those are the people who get high blood pressure from being overexposed to salt. And then there's this inverse salt sensitivity, which is if you don't have enough salt, you can also have a cardiac event or high blood pressure. So these are kind of areas of research that are opportunities for the future. How do we pick the right balance of salt, and how do we know whether we're a person who's sensitive or not sensitive? These are recommendations from the Pediatric Society explaining that if you want to reduce your impact on blood pressure and hypertension, as a pediatric person, you want to have at least 3 to 5 episodes of exercise, moderate to vigorous exercise, and also follow one of these salt diets, these low salt diets. Another place we're failing, in addition to food, we're failing in aerobic and strengthening exercises. You can see it's pretty poor. So there's opportunity to improve here. And so we made this cute little guide for you, and we hope that you'll pick some activities that you can put into this chart on the left that will help us with our attempts to reach out to people. And then find the lobster in this grid of pictures. If you can take a few minutes to look through the Salty Six guide on the left and identify some item that you might replace it with from your own pictures, from some menu you like, whatever your favorite item is, and then let us know about it. Tom, do you have a couple of minutes to talk about the history of blood pressure measurement?
I can certainly try to address that, Kit, but the slide, I think, discusses blood pressure measurement from the early days, starting back in the late 1800s, and the original device and technique was primarily to put an inflatable cuff around the arm, inflate it until it would basically block off the blood flowing in your arm, and then gradually release the pressure in the cup and wait for when the blood started flowing in your arm, and that would be detected with typically a stethoscope. And so based on what pressures were involved in the various states of the blood returning to flow in your arm, you could get an idea of the patient's blood pressure. And Kit, I'm sure you can go into better description than I can on that.
We're done now. So that's one of the ways in which we calibrate all the electronic devices that are used now. So we take the original measurements and we try to see how closely they calibrate to the modern measurements. So as people begin to eliminate those mercury devices, it's becoming more and more challenging to calibrate the new devices and to understand what we're really measuring, because the new devices can go wrong in so many different ways. So these are big challenges for all of us as engineers, as health people, as consumers of these items. And so one of the things that we've tried to implement as a society is to have the validation, and we'd like to promote more validation of devices so that we know that when we buy something to use, that it has some level of engineering integrity and that it has some relevance in its use. These tables we've provided for you so you can follow some reasonable instructions on how to take the blood pressure. In other words, spend about 2 hours making sure you haven't had caffeine and alcohol and exercise and all the things that might interfere with taking a blood pressure. And then about 3 to 5 minutes before taking it, sit in a chair quietly with your back supported and your feet on the floor, and then have a person apply the cuff to your arm in the right position. And then, of course, the right size cuff has to be used. And we've given you a chart on how to measure the arm to find the right size cuff. Of course, the cuffs we've distributed to you are within the range of what you need. And then, of course, we can notice that the cuff we sent you, which is an oscillometric cuff, it corresponds in some way to the sphygmomanometer that we were looking at before. And we can learn what that correlation is by looking at this handy guide. There is a guide somewhere. Oh no, I've lost the guide. Here it is.
So, Keith, just a quick note. We have probably 10 minutes left. So
thanks.
We have probably 10 minutes or less left from the class.
Okay. So let me just show you this one slide, and then we'll go back and open to questions. So this slide shows you on the left the original way that people like engineers and doctors would measure blood pressure. Item A shows you how, as you deflate the cuff, listening for those sounds, those correct cuff sounds that tell you what part of the blood pressure you're hearing, or part of the pressure in the vein you're hearing. Those give you the measurement that is taken like very, very slowly using a manual approach. And on the right, you see the technique that's typically used by oscillometric or the digital devices, where they measure an entirely different signal. They measure the mean arterial pressure, and they do a calculation that tends to be proprietary to the company. So they're looking at the same signal, but they're doing a different kind of analysis. And this is important for engineers to understand. And it's something that makes the function of the device work differently. And those things would be very good for inquiry. Also, how the devices, how the cuffs are measured, how the arm is measured. We can see here that there's a measuring tape used to find the middle of the arm, and then a measuring tape used to find the circumference of the arm. And these are the kinds of errors that can take place, which you may have read about. If you're talking, it could actually change your blood pressure by 4 to 19 points. If your legs are crossed, 2 to 15, and just using a different kind of device, the oscillometric device, which is the one you're being sent, you can alter the blood pressure reading by between 5 and 32 points just by changing the kind of device you're using. So we want to turn over this discussion to you for questions, and we're going to leave you with those 2 assignments and with the optimism that you'll be able to take blood pressure as a team. The floor to questions.
Right. We have, Ariana has a question.
Excellent. Hi.
Do you think that children, like I remember the chart you had, it was a long yellow line. Do you think that is due because bad food is cheaper and most families who are low income have to serve their children, you know, like cheaper food that's not high in nutrients? Do you think that's why it's so high?
It's possible. So I look forward to hearing your discussion of that in the survey that we gave you, and to also hear your opinion if we believe that, but we want to hear that from you. Living stories, you know, people's lived experience is the most important thing. If you could share with us in your video, if you're going to take the 30-second video, if you could share with us that, we would really love to hear that. We do believe that that's the case. We believe that it's difficult to preserve fresh food, which might be healthier. So apples or strawberries or other things that are delicious and healthy are hard to keep in your house for long periods of time. They're even hard to keep in the stores for long periods of time. So people resort to things they can keep on the shelf for a while, like cereals and snack foods. They're much easier to keep, and they're easier to transport, and they're easier to buy in many neighborhoods. So if you could share those stories with us, we can also share some information with you that has been gathered in research studies. But as I mentioned, you know your life best of all. You know if you have an opportunity to buy other foods or to ask your family to buy other foods. You know that kind of thing, and we'd love to hear from you. Paula, do you have any comment about that?
No, Kid, I think you summarized it very well. We know the issues with accessing, but it's also education, making sure that you make the right choices, because they really have an impact in the long term. And heart conditions is just one manifestation, but that has implications to many other comorbidities.
Yes, for me in my own personal life, I like to have a menu in front of me all the time, because I get tired and I don't know what to think I might want to eat. But when I see a menu in front of me, it's easy. When you go to a fast food place and you see this menu in front of you, it's easy to choose something. And so that's why we gave you the poster, is to help you think about making your own menus. Because when you're feeling well and you're thinking carefully,
I'll post that for you. I don't know.
identify those good foods, then you can make your own menu. And when you're tired and have difficulty making a choice, you can look at your menu and make a better choice. Does that make sense?
Yes.
And if I may add, it's really simple. Think about your plate that you divided in three areas, and the smallest area should be all the starch, the rice, the potato. The other third should be all your vegetables, and then the rest it should be mostly fish and white meat. And then always a lot of hydration, a lot of liquid, and color. Color is always a healthy decision. So just a small tip.
I wanted to let you know that all those pictures of food came from my kitchen.
That's great. That's great.
I'm a fanatic about taking pictures of food, and I used to hear a lot of people comment about, oh, Instagram, why do we want to know what you ate? It's so important. You can't underestimate that. How beautiful the food looks makes you feel comforted, I think, you know? So, anyone
Over
else?
the next 2 weeks, the students will work on that survey, and they'll work on doing that video, and they'll post it on there, and they'll also post the form that you have about the menu there for them. Okay?
Wonderful.
Guys, how much time do we have left? When is the bell ring? 2 minutes. All right. Any last minute questions? High School South, does anybody have any questions? No. All right. Thank you, Dakota. I appreciate the head nod. All right. Thank you, guys. In about 2 minutes, the bell's going to ring. Give a wave.
Thank you.
And my next class will come in. So I'm just going to mute us for now so I can talk to the kids about a few things.
Perfect. And we'll just go into the next meeting room, right?
You can stay here. And this one, I think it's just my classes, but I'll text Mary Beth and see.
I think my Zoom will end and we have to
Oh,
start.
okay.
Yeah.
So I'll go into the next one. That's fine. And then Mrs. Wallace, did you guys hear that? Dakota, did Mrs. Wallace hear to go to the next link? Yes, great. Thanks, Sam.
Perfect. Thank you so much. Thanks for inviting us.